Hey, Dr. Josh, video number 3, we're talking about supporting body systems for supporting immune function, and we treat the body as a whole. So in functional medicine, if you look at the iceberg, the tip of the iceberg is above the water, right? And that is when we look at that, we look at symptomatic response, and even labeling diseases with disease processes. But underneath the water are all the systems and the malfunction of the systems that are the causative factors, the root causes to issues that can and challenges that continue to rise. So in supporting body systems, especially in immune health, we're going to be looking, and I truly feel the 4 categories here, these 4 systems are detrimental to our immune function. Number 1, the ability to detox, okay? So when we're decreasing our viral load, right, and we're decreasing the ability for this virus to replicate, we have to be able to have our detoxification system working optimally. If we have an overloaded toxic burden in our body, we have an immune system that's attending to too many things. So when we get that burden of toxicity to decrease through a detoxification system that's working, we have more of our immune system that can attend to the higher level of threats, i.e. the virus. So detoxification. And so we have different components of our detoxification processes that are available to, do more of a general detox and open up the immune system's capacity against pathogens and antigens. Number 1, intestinal system. Our intestinal system is the first thing that meets anything from the outside environment. So we have to have a properly functioning digestive system, okay? That goes through digestion, absorption, and elimination. And those things need to be working correctly in order for our body to eliminate these pathogenic loads. Respiratory, obviously these are respiratory diseases. So we have to have a respiration system that is working optimally, okay? I can't stress exercise, deep breathing, the strength of our respiratory cells enough in this situation. Get out, exercise. If you don't have an exercise program, look at something that's including like high intensity interval training, so you're getting that deep breathing and you're strengthening the cells of your respiratory system. And cardiovascular, once the inflammatory cascade happens, we have an immune response that's trying to get after that viral load, and a body that heats itself up just enough and produces these cytokines to try and get rid of the virus. It's going to attack the cardiovascular system. So we want to make sure that our cardiovascular system, the system that carries our blood all over our body for nutrients and recycling and absorption, we want to make sure that the cardiovascular system is working as optimally as possible. And that doesn't exclude any of the other systems in the body, but these are ones that we specifically look at. So we want to control inflammation. Okay, so that's the biggest thing, is being able to calm down inflammatory responses. Number 2, we want to have nutrient sufficiency. So we don't work on caloric intake. Nutritionally, first and foremost, we want to make sure that we're getting the nutrients that our body needs to support our cellular function. So that's nutrient sufficiency. The third one is energy production. We want to have the ability to optimally produce ATP. So we have organelles in our cells, which are called mitochondria, and they have to be able to be working correctly in order to create an abundant amount of ATP to fuel our cells so they work correctly. And that really is it. So we have to support our body systems. Detox, metabolic, keeping ourselves primed through exercise, all right? And so if you're looking for help and you need help to do this in a specific way that we're finding is working excellent for our patients, DM us, ask us. We'll be able to help guide you through the right type of processes and treatment systems that will be able to help you support your body systems. All right, on to video number 4. We'll see you there.